welcome to Health Live at Seniors Today. We're here once again Saturday evening and back with another session of Health Live. Today we have with us Dr. Raksha Vaishnav. Dr. Raksha Vaishnav is a senior consultant, cataract and glaucoma at the Nethradhama Eye Hospital in Bengaluru. I will introduce her first and then welcome her. Dr. Raksha Vaishnav is a cataract and glaucoma specialist, as I mentioned, with over 15 years of experience. She completed her MBBS from the Sion Medical at the LTMMC in Mumbai and did her DNB ophthalmology from the very well-known Aravind Hospital in Madurai. She further did her fellowship in glaucoma from Nethradhama Super Speciality Hospital in Bengaluru, where she is working right now. Dr. Vaishnav is a skilled surgeon and has vast experience in cataract and glaucoma surgeries. She has also trained and mentored several postgraduate students and fellows during her tenure at different institutions. Dr. Vaishnav is a member of BOS, KOS, GOS, AIOS, and GSI, and has presented posters at multiple national conferences. She's also written newspaper articles, conducted several webinars for public awareness of cataract and glaucoma, and she has also co-authored a paper on the use of artificial intelligence in ophthalmology. Welcome to Health Live at Seniors Today, Dr. Vaishnav. How are you?
Hi, I'm doing good, sir. Thank you so much. Good evening to you.
Good evening. And I forgot to mention that this is also World Glaucoma Week, and which is why we thought that we would do this session this week. There was last month was the awareness month, and this is the awareness week. So it is appropriate that we are having this session today. Dr. Vaishnav, before we request you to make a presentation, and before, as our people are entering the room, just wanted to check with you: do you find that the number of cases of people having glaucoma has increased over the years? In your 15 years of practice, has that number increased?
Yes, definitely. I feel so. The numbers has increased. Mostly one days people are becoming more aware about this problem. This is like one of the third commonest cause of blindness, and there are very few people who know about it. So every year, I mean, we try to do this awareness campaign so that people come to know about it. One, because of that, and secondly, the most commonest factor why it is happening is also because the lifestyle diseases in the society are increasing. Like you see now the age group for hypertension, diabetes, high cholesterol. Previously, if you would have seen, they were starting at the age of 50s or 60s, but then now we are seeing much, much younger people coming with hypertension and diabetes. This is one of the commonest reason, again, why we are seeing a lot of glaucoma patients nowadays.
And, and what about cataract? Has that number also increased?
Cataract numbers, yes, again, it is related to the lifestyle disorders, so the cataract numbers are also increasing, yes, proportionately increasing.
Over to you, Doctor, for your presentation. Those of you who are here, as Dr. readies her presentation and to put it up on the screen, which will last for around 20-25 minutes, please put your question in the Q&A tab. As always, mention your age and your gender, and we will take the questions depending, of course, if they're not repeated or if you are from the valid age group of 60 plus. Over to you, Doctor.
Good evening, one and all. I'm Dr. Raksha, and so we will be talking about two major topics today. One is glaucoma and one is cataract. Actually, the time given is 20 minutes, so I will try to cover only the common things in these diseases so that we can cover the topic. Before starting the presentation, I would like to give a little bit of brief regarding how does the human eye look like. As we can see here, we are seeing the side of the eye. The front part of the eye is called as the cornea. In between, what you see is the lens. So this exactly is the area where the cataract happens. It is suspended by some ligaments, which are called as the iris and zonules. And behind what we see here, this is a gel-like structure which is present inside the eye. And behind it is connected with the optic nerve to the brain. Because the topic is so, I thought that I should show this slide. Now, what is coming to glaucoma? What is glaucoma? Glaucoma is basically a disease that damages the optic nerve, the nerve which is going to the brain. Now, why does it happen? It happens because when the fluid builds up in front of the eye, the extra fluid increases the pressure in your eye and damages the optic nerve. In glaucoma, the vision usually starts getting affected from the sides or from the periphery, and then it starts coming in the center and ultimately leading to blindness. Glaucoma is irreversible, and the progression can only be halted by early diagnosis and treatment. I have a small video to share so that some people can get an idea regarding what we have to say. So I'll just give you a brief. So this is how the eye looks, and this is what we are talking about. Here the pressure builds up, and when this pressure builds up, it causes direct damage to the optic nerve. Just play a small video.
In the healthy eye, fluid called aqueous humor is made in the front of the eye and flows out through a tiny drain called the trabecular meshwork. The trabecular meshwork is located in an area called the drainage angle. If fluid doesn't flow out of the drainage angle properly, eye pressure increases and damages the optic nerve.
So now the types of glaucoma, as we saw that it is because of increased eye pressure. Now why does that happen? There are different types of glaucoma, the common one being the open angle glaucoma and angle closure glaucoma. So this is the eye, again you are seeing from this side. Normally there is a fluid which will be passing from here and it will be draining out from this side. Whenever there is resistance in this area, as we can see, it is forming an angle between the cornea as well as the iris. Whenever there is a resistance, the fluid is not able to go. When the fluid or the aqueous humor is not able to go, it will create a back pressure. The pressure will increase here and ultimately it will cause angle damage. Another type of glaucoma is where this iris moves in the front and it tries to touch the cornea or the front side of the eye. Now here what happens is the fluid again is not able to go. There is bowing of this area and ultimately the pressure increases. We have seen patients where patients come with something called as an acute angle glaucoma. The way you have heart attack, there is something called as an eye attack, wherein the fluid will not be able to go at all and the back pressure will happen and the patient can even lose vision. That is called as an acute eye attack also. So all of us has to be very careful about it. Now, what are the risk factors? Usually, glaucoma is a disease of the elderly. We see in people mostly above the age of 50. The most commonest cause also being family history. So, anybody's parents or grandparents having glaucoma, genetically they can get glaucoma as well. Other reasons for glaucoma, anybody having high minus power, high myopes or high hyperopes, having a minus power which is very high, like -8, -10. These people are prone for glaucoma. Also, some other reasons for glaucoma are anybody getting any trauma while playing or injuries. These are the causes for secondary glaucomas. So, what are the signs and symptoms? Usually, open angle glaucomas do not have any signs and symptoms. Closed angle glaucomas are the ones which comes with sometimes watering of the eye, redness of the eye, too much of pain, fatigue, head pain. So glaucoma is also called as the silent thief of sight. Now, what do we mean by silent thief of sight? As in the vision is going, but the patient does not realize that the vision is gone. As we can see here, this is a normal vision, how everybody perceives. Early stage of glaucoma, we can see there is a black patch which is coming here surrounding. Then it advances to this stage and ultimately it goes to this stage. It is also called as tunnel vision. So when we are going on the road and we pass the tunnel, how do we feel that there is darkness around and only the center part we can see. So in glaucoma, the vision goes from the sides. So how do we diagnose? So when you come to our clinic, what we do, we check your vision first. That's the most commonest step which we do first. Secondly, we will check your eye pressure. Because it is a disease of the eye pressure, we are using instruments like tonopens. Tonometry is the instrument which is used to calculate the eye pressure. So this is a prism which we will be using. This will be coming in direct contact with the eye and the pressure reading comes for us. Secondly, we use instruments like the gonio prisms and gonio lenses. Now, why are these used? These are the lenses which are placed over the eye to check whether it is an open angle glaucoma or a closed angle glaucoma. Another investigation what we do is we do a slit lamp examination of the optic nerve. As you all can see, this is a normal optic nerve. It looks very red and pink and nice. In cases of glaucoma, from this stage, it will go to this stage, wherein you can see it has become almost white. That means that whatever nerve fiber layers were here, they are all dead and the cup has increased and the patient has started losing vision from the sides. We also do an investigation called as visual field analysis. In this, the patient has to sit in a dark room and there will be light which will be coming on a monitor. Whenever the patient sees the light, he presses the button. We get a printout which gives us an analysis wherein we get these black patches which tell us that this much of vision is gone. When it progresses, the vision goes like this, and this is kind of an advanced stage. Another investigation which we commonly do is called as the optic nerve head analysis. So here what we do is we will do analysis of the optic nerve and we will try to match it with normal people of your age group, and it gives us a graphical representation of how much the damage has happened. And we also check the central corneal thickness for the same. Now, what is the treatment for glaucoma? Treatment for glaucoma, usually to reduce the eye pressure, we will first give drops to reduce the eye pressure. If the pressure is not coming in under control, then we use some lasers like trabeculoplasty and iridotomy. Trabeculoplasty is usually used for open angle glaucoma, wherein we make some small holes inside the trabecular measure to drain the fluid. As you can see here, I have shown a picture of laser iridotomy, wherein the fluid buildup was already happening behind the iris. We make a small hole here on the iris so that the fluid buildup doesn't happen and the fluid keeps on moving. So with the lasers also, if the pressure is not coming down, then we do surgeries. There are some surgeries called as trabeculectomy. We can see a picture here where we have shown that what we do is we make a flat kind of incision in the white part of the eye and we try to drain the fluid from inside towards the outside, and this is how we reduce the pressure. Other devices which are used for the control of eye pressure are some shunts. So there is Ahmed glaucoma, Val, Molteno, and the newer stent, there is a newer shunt called as an eye stent. Now, eye stent is a very, very small stent which is used inside, and we just plug it inside into one of the trabecular meshwork holes. And with that, the fluid keeps on passing from this area and increased pressure doesn't happen. So a lot of patients would like to ask, like, what can I do to prevent glaucoma? So these are certain things which you can do. First of all, you should avoid smoking because smoking causes a lot of vasoconstriction inside the body and it can increase pressure. Glaucoma is also commonly seen in people who use a lot of musical instruments like saxophones. As you can see, they have to blow a lot of air against pressure and that can increase the eye pressure. Also in glaucoma, we tell the patient not to do yoga poses like Shirshasana because when you do that, there is pooling of blood in the head and that can increase the eye pressure. Of course, you have to reduce the stress levels and reduce the caffeine intake. How do you improve it? You can have a lot of fruits and vegetables, maintain an ideal body weight, exercise regularly. Deep breathing exercises is something which all of us have to do because it increases the oxygen levels inside the body and it helps in the ocular perfusion of the optic nerve. So we are done with the glaucoma part. Now we can go ahead with cataract because this is again one of the commonest cause of blindness. So what is cataract? Cataract is basically clouding of the lens in the eye that affects the vision. It is a disease of the age, that is, it starts up to the age of 50 and 60. It is more common in the elderly people. In a normal eye, so this is just to show you, this is a normal eye and this is again the side view of the eye. As we can see, the rays of light will go inside the eye if the lens is very clear. It will go inside and form an image, and this image will be transmitted by the optic nerve to the brain, and this is how a person sees. But with cataract, as you can see, the center part has become a little cloudy. So when this becomes very cloudy, what happens is the rays of light are not able to go and they do not form regular images, and because of which the patient is unable to see. So this is how cataract looks like. So there are different gradings of cataract. Normal lens is crystalline clear. Immature is when it is not totally cloudy, it is little cloudy. So if it is very, very early stage, we ask the patient that you can wait for 6 more months, come for a checkup. Only when it is a little more thicker, we will remove. Another stage is mature cataract. As you can see, this gentleman is having a mature cataract in the right eye. So it is also called as moti in Hindi. That means, it is looking like a pearl. So that is how the name is. Hypermature cataract is wherein, it has become to that extent that, sometimes it can burst inside the eye itself. So that is why getting your cataracts done at the right time is also very important. What are the causes of cataract? The lens is usually made up of water and proteins. As we age, what happens is the protein starts clumping inside and they clump together and form clouds inside the lens. This is what is called as cataract. So as it grows, it becomes difficult for the patient to see. Why it happens? People who are having uncontrolled diabetes, their blood sugars are always on the higher side. People who have diabetes whose blood sugars are always on the higher side, or BP which is not under control, or high cholesterol levels. These are the people who are more prone for cataract. Other than that, there are some people who use steroids for a very long time for some skin diseases or for lung diseases. These are the patients who are also prone for cataract as well as glaucoma. Of course, even smoking adds to it. So symptoms of cataract, what does a patient see? So this is how the vision of the cataract patient will be. As you can see, this is a clear image. But here in cataract, as you can see, the cloudiness is more central and it is totally overall hazy. What we saw in glaucoma was that the vision was going from the sides. It was not in the center. But in cataract, the patient realizes early that he has cataract because it is overall very cloudy. Other symptoms will be patients will have difficulty in perceiving colors. They will have difficulty in driving in the night because of the cloudiness of the lens when they are driving on the roads. There will be lot of glare, headlights, lamps. Even if they go in the sunlight, they feel it is very, very bright because it causes a lot of glare inside the eye, and it also causes poor night vision. So again, how do we diagnose it? When you come to our clinic, we do a detailed eye examination to check how much is your vision. Then we ask, then they will put some drops to check, to relax the muscles of the eye, and then that will give us an idea of what is the grade of cataract. After that, we will check the eye pressure, and in all, we will give you an analysis. So what is the treatment for cataract? As I said, in early cases, we ask the patient just to change the eyeglasses for better vision if it is not very ripe. But then if the patient is coming in the last grade, like grade 3 and 4, that is the time we advise them for surgery. Now, what is the surgery? Surgery usually involves removing the cloudy lens and we replace it with the artificial lens, which is measured of the patient. What are the types of cataract surgery? So conventionally, we were using surgeries like ECC. This is called as extracapsular cataract extraction, wherein the incision size which was used to remove the cataract was very big. It was around 6 mm. Then with the advent, things changed and now the incisions have become smaller. So now small incision cataract surgery is where we use the incision which is used is hardly 5 mm to 4 mm. The thing which we are using nowadays is called as MICS or micro incision cataract surgery, also called as phacoemulsification. Here, the incision size to remove the cataract is hardly 2.5 to 3 mm. And we use a laser energy or ultrasound energy to remove the cataract. And after removing the cataract, the patient's calculated intraocular lens is fixed into the eye. So what are the types of lenses which are used nowadays? There's something called as monofocal lens. There's something called as toric and multifocal lens. Now, what is monofocal lens? Monofocal lenses are used for patients who wants only distance correction to be good. They are willing to wear near vision glasses. Monofocal lenses can be used. Toric lenses are usually used in people who have a very high cylindrical lenses. If the patient says that I don't want to use glasses at all, then we have specialized lenses called as multifocal lenses, wherein the distance as well as the near can be cleared just by putting the multifocal lenses. So we have a small video here which we'll play, which shows the how the cataract surgery is done.
Usually with cataract surgery, a small incision is made in the eye. The front portion of the thin outer covering of the lens is opened to allow removal of the cataract inside. The cataract is gently broken up and vacuumed out. Then a folded lens implant is inserted through the small incision and into the capsule where it unfolds and permanently takes the place of the clouded natural lens. With the cataract removed, the new lens implant clearly focuses light rays onto the retina. The power of the lens implant is selected for your individual eye.
So as we saw, we remove the front part of the eye. that is the capsule. We remove the internal material, and after that we fix the required intraocular lens inside the eye.
Usually with cataract surgery, a small
So how can I prevent cataract? Again, eat right. That is food which is very high in antioxidants like vitamin C, vitamin E may help to prevent cataract. Quit smoking, wear sunglasses, because even ultraviolet rays is one of the factor which can increase the cataract if you are exposed directly to the sun. Keep your blood sugar and blood pressure in check and get your eyes checked at least once in a year. Thank you.
Thank you very much.
This
Thank you
was
very much.
just actually, I did not go too much in detail because there were two topics to be covered,
Yeah.
but this is from the patient public awareness point of view, which we try to do.
Very detailed and give a good idea of what it is. Can I start with the questions? We have a question from Mr. Umesh Kuncharkar, who is 70 years old. He says he got cataract of both eyes last 3 years back. He has regular checkups. He have seen many young generation get operated upon, and he wants to know what are the reasons.
So as I said, now cataract and glaucoma both have become like lifestyle disorders. As I said that now we are seeing diabetes, hypertension, high cholesterol in the youngers. So we are seeing the cataracts also coming up, and that is why we need to operate these younger generations also now.
We have a question from Mr. Satish Kalia, who's 78. He says his diabetes has been well controlled for the last 15 years. He asks, can you throw some light on visible signs of glaucoma to a patient? And do pranayam and yogic exercise enhance the onset of glaucoma?
So as I said, so for glaucoma, pranayam, deep breathing exercises, actually you should do if you are detected with glaucoma or if you are in your 70s or 80s, because why? Because it increases the oxygen levels inside the body, and because of that the blood supply which is happening to the optic nerve is also increased. So the chances of glaucoma occurring in the elderly also is reduced. But there are some yogic techniques which have required lot of forceful expiration and inspiration. There are some yogic techniques wherein you close your nose and you try to do. These are the things which you should not do, because these are the ones which can increase your eye pressure. As I said, even sirsasana. So people who are doing sirsasana, that is the head is down and the legs are up. So what happens is the pooling of blood happens and all the weight comes onto your head. Now this can also increase the eye pressure. So ideally you should avoid that.
And is this only for seniors, or even people at a younger age should not be doing these exercises?
No, younger age can do, but then mostly for the seniors, I think it is avoided because already the body is in degeneration mode. So after a particular age, the body starts loosening up. The blood supply is already compromised because of hypertension, diabetes, and all. So when you add to these yogic postures, it adds to the burden of glaucoma and cataract. I mean, for the glaucoma person.
Right. Thank you. We have a question from Shamla Ravi. She says, earlier it was said that cataract is to get matured to operate on, Now, some doctors say it is not necessary to wait for the maturity. What is the correct stage to operate a cataract?
As I showed in the picture, there are different stages of cataract. So 1, 2, 3, and 4. So when the patients come to us, we give them a choice. If the patient is in the first and second grade, where they can see all the lines of the vision test which we are doing, and it's only 1 or 2 lines they can't see, we tell them that, it is not ripe enough from inside. So basically ripe enough from inside means it is just like a jelly. So when we go to remove, sometimes it can be difficult to remove. It is too much like a jelly. Now coming to the question, as the patient is asking that, if it goes to the hard stage, which used to happen in the olden days, as I said, in the olden days, the incision what we used to use, the cut which we used to make to remove the cataract was very big. So in that case, even if your cataract has become very hard or it is in the last stage, it is okay, we could remove. Nowadays, with the advent of surgery, the new technology, even if the patient is not seeing like 2 lines and it is not totally mature, the laser is able to penetrate and cut it, and we can do it from a smaller incision. But if you wait for the last stage or matured stage for it to happen, then the laser which we use to cut the cataract, it is not able to penetrate, and because of that there can be a risk of complications sometime. So that is why we demarcate it, and with our personal experience, we say that, this is okay, you can get it done or you can wait.
Right. Thank you. We have a question from Lakshmi Kumar Valvala. The question is, after the insertion of new lens after surgery, will the eyesight remain stable for rest of life? I mean, the number doesn't increase. Will the number increase, or will it be stable?
No, so we do the calculation of the eye power before putting the lens. It is like the way you wear glasses. After a particular age, your number becomes same. It does not increase. Before putting the lens into the eye, we do a calculation with a machine, and the required power is put inside the eye. So usually once the power is put inside the eye, it usually doesn't increase. It remains stable most of the time.
Right, doctor. I've got a question by SMS. This is from an anonymous attendee who asks, Doctor, we have heard of cases where certain eye surgeries have failed, especially in the improvement of eyesight. Is there a possibility of the cataract laser surgery also not working?
Sorry, I didn't get the last part of it. What did you say?
Is there a possibility of a cataract surgery also not working for me?
So as I said, if you are coming in the last stage of cataract, wherein the cataract has already become black, or as I showed in the picture, it has become totally white. Now, in this case, what happens is, if the patient has not got operated at the right time, because of this, cataract can also increase the eye pressure. And because of that eye pressure, even the optic nerve can get damaged. So we can't, even when you come to us, we cannot visualize the optic nerve if the cataract is very hard. In that case, once the damage is done to the optic nerve, even if we remove the cataract, sometimes the patient may not get the vision. So that is why getting it operated at the right time becomes important.
Right. Thank you. We have a question from an anonymous attendee who asks, what are the causes of diplopia, and what is it connected with cataract, and what is the treatment?
So diplopia usually happens because of something called as muscle paralysis. So we have various muscles which are connected surrounding the eye. Whenever there is increase in blood sugar, or if your sugar levels or diabetes patient, if it goes too high, because of that, what happens is one of the muscle can stop functioning. That is the time what happens is the eyeball will fail to rotate on either sides. And that is the time the patient sees double. Usually it does not happen with cataract. It is because of muscle paralysis.
Right. Thank you. We have a question from Katie Dadanchi who says, Doctor, my husband who's 78 just got his cataract removed. The doctor said he has dry macular degeneration. What measures can be taken to avoid it from turning into a wet macular degeneration, which then requires costly injections which have to be taken continuously for an indefinite period of time? He has no diabetes or high cholesterol.
Okay, so age-related macular degeneration is again a disease which affects the retina or the back part of the eye, wherein there will be some scar formation on your retina. So the light rays which are going inside the eye are not able to form an image. Now, how do we avoid it? It is common in patients who are smokers or people who are having alcohol. Again, the pathogenesis is same because of vasoconstriction. There is no blood supply which is happening to the retina, and because of which this can happen. How do we avoid it is by having good intake of antioxidants in forms of, you can, so if you go to the doctor, they will give you some antioxidant capsules or tablets which you can take. That is one form. So it is categorized into dry and wet. Dry is a stage wherein, the vision is not too much compromised, but wet is the stage wherein the fluid gets accumulated in the dry area and the vision starts going down. So have a good antioxidant diet, like having more fruits, vegetables. If you are a non-vegetarian, you can have more of fish because it has a lot of omega-3 fatty acids, vitamin E. This is the kind of diet you should try to have, and also have a lot of greens in your diet. Green leafy vegetables also help in the antioxidants.
Right. Thank you. We have a question from Marjorie Fernandez who asks, sometimes my eyes seem to be getting flashes during which I can't see much. This lasts for a few months, for a few minutes, and then the flashes disappear and my sight becomes okay. What sort of a problem am I facing? He asks.
So flashes of light is again related to the retina part. So if you are seeing flashes on and off, this is most commonly seen in people who have a very high minus power, like -2, -3 and all, or after an injury, you can see flashes. If such kind of thing is happening, you have to go to the doctor and get your eyes checked, because there is a possibility that in the side of the retina or the peripheral part of the retina, there could be a break or a hole wherein, the layers of the retina have started to get separated. There are 10 layers of retina, so one of the layers could have started to get separated, and because of that, whenever you are doing the eye movement, you are seeing the flashes. So I would advise it is better you go to the doctor and get it checked.
So there's an interesting question that has come in. Doctor, it's very difficult to get an appointment with an eye specialist. Is it okay if I get my eyes tested at the optician?
I would not recommend that because in my practice, what I have seen is patients coming to us at the advanced stage where we can't help them. Because what the optometrist or the optical person sees, they do not have the required instruments to check the eyes. They do not do the in-depth analysis. All what they do is they just check the power and give you. But then in that case, what happens is your retina is not checked. If you are having blood sugar levels which are high, you would not know if there is some bleeding which is happening inside, and you will just you will delay your consultation with the doctor, and if that increases, you can lose your vision. So I would not advocate it. I would say take out time and please get your eyes checked.
Right. Thank you. We have a question from another question from Lakshmi Kumari uh, Vavilala. Why do bright red spots get seen at the end of our eye on the whole portion? What may be the cause? And another question is, what are the causes of dry eyes and how do you treat them?
So red spots where on the outer side of the eye is what they're
The
asking.
end of the eye, yeah.
So end of the eye, there are some blood vessels which you can see, the lines which you see. So these are basically the blood vessels which are running below the skin of the eye. So sometimes if you're scratching too much or if you're rubbing your eyes, they become prominent. But if they just come and go, it is okay. But then if they are staying for a very long time, then you need to get it checked. The second question, sir, was regarding dry eyes.
Dry eyes, right.
Yeah, so nowadays, this dry eye is also called as computer vision syndrome in our language. So it has become like a syndrome. So basically, why it happens is because all of us around now, I am also speaking on a screen. So everybody is using the screen everywhere, maybe even in the form of phones or gadgets or iPads or laptops, whatever you can say. And the most of the people who are in the IT company, they are spending their time in front of the screen for 8 to 10 hours. So what happens is when you are continuously looking at the screen, you forget to blink. That is the time the water which is there in front of the eye, it gets evaporated and the dryness sets in. So nowadays we are seeing a lot of children who are using a lot of mobile at home. They are not playing. They are also coming with a lot of dryness. So the simple solution for this is you have to remind yourself to blink your eyes very frequently. Use adequate light. Whenever you are using the gadgets, you should start using anti-glare in front of that, or try using your screens in the night mode. These are some of the things which you can do. If you're feeling too dry, you can just splash normal water, whatever is available. That will help you.
Right. Thank you. We have a question, just one or two more questions from Umesh Kuncharkar. Another question that he's asking, Doctor, how long do we take rest after a cataract surgery? Is there any diet control required after the surgery?
So cataract surgery now has become like a daycare surgery, wherein the surgery is done in 15-20 minutes and we discharge the patient. The only precautions are we give you some drops to use for at least a period of 1 month. The ideal rest period, what we advise is 2 weeks. You have to be careful. You have to be indoors. You cannot go out. If you want to go out for a walk, you can wear the protective glasses and you can go out. Why? Because the incision which we are making, it takes some time to heal. So if you go out and if you expose yourself to dust, there is a risk of infection. So ideal period is like 2 weeks, and after that you can start working also slowly.
Um, Doctor, I have the option of choosing when my cataract surgery can happen. I have two questions. One is that should I get both the eyes done one after the other? And second, is there a better season for cataract surgery, summer or winter?
No, there is no seasonal preponderance here because we are doing cataract surgery almost every alternate day. The only thing is, what was the first part, sir? What you said?
about
Getting both the eyes. So if you are diagnosed with cataract in both the eyes, I would recommend that you undergo the surgery for both the eyes. Why is because for cataract surgery, you do some investigations before the surgery. So when you're doing one eye, when you do both the eyes, the investigations takes part of it. Second thing is we give you drops to put, which is for 1 month. When you do the surgery in a span of 2 to 3 days for both eyes, you can might as well put the drops in both the eyes and finish your work in 1 month. Otherwise, you have to go through the entire process again. So we usually do both the eyes if the patient has cataract. We give a span of 3 4 days and we try to do both the eyes. We don't wait too much.
right. Thank you very much, Dr. Raksha Vaishnav, for this session. We've answered quite a few questions and all of them remarkably well. We did not have a technical glitch. Also, all of you here, first of all, thank you to Dr. Raksha Vaishnav and the Nethradhama team for facilitating this. We will be back once again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. As you know, you can pre-register for the Health Live sessions. The link is there in the chat window. You can pre-register and send us your name, address, your email address, phone number, and we will have you registered in that. We have the Seniors Have Talent, which is going on right now, season 14, every Wednesday evening, and the finale, which is coming up on April 7th. So once again, that is there. Plus, of course, the magazine, the Seniors Today magazine, we have had 56 issues of the magazine. And I'm going to request our producer, and I would request you also, Dr. Raksha Vaishnav, to have a look at the 56 covers of the magazine that we've had so far. So this is we started in July 2019. And as we get ready for the share the screen problems happen at our end as well. No worries. So we started in July 2019, and we had a cover story on Lata Mangeshkar, a cover interview with Lata Mangeshkar. We were very fortunate to be granted an interview with the Nightingale. So this is the first issue. Then we had a woman on Kashmir. We have a fair amount of defense stories, stroke. Yeah, so great mix of, even though I say it myself, great mix of stories that we've had. Of course, we've had a fair number of stories on health. We've had some stories on entertainment, as well as on cricket, but a good mix of stories. We have a lot of emphasis on relationships, on issues concerning senior citizens, and these are beyond pensions, etc., that concern senior citizens. These are actual issues in real life, in our everyday lives that people face, and that is what Seniors Today is all about. I know it's a bit of a plug for ourselves, but so be it. Thank you very much, Dr. Raksha Vaishnav, for being here. It was a pleasure having you here as part of the health webinar series that we've been doing. Thank you once again.
We would also like to thank you and from the entire Nethradhama family for having us live here. I hope this gave some awareness regarding cataract and glaucoma, and I'm more than happy that so many people asked me a question and I could justify. Thank you for your time, everybody, all of you, and thank you, sir, so much.
Thank you very much. Thank you once again. Thank you very much.
You.
All right, and see you again next Saturday at 5 p.m. for another session of Health Live at Seniors Today.
Thank you, sir. Thank you.
Subscribe now and press the bell icon. Never miss an update.